Hello, I'm Colleen Chawla, and I'm the current president of the County Health Executives Association of California. I also have the great honor of serving the more than 1.6 million residents of Alameda County as the Healthcare Services Agency Director. It's been a challenging 16 months, responding to a pandemic that confirmed the worst fears of my public health colleagues who serve across California's 61 local health jurisdictions. As we moved into last year's shelter-in-place restrictions across the state, it was clear that our public health infrastructure was insufficient for a crisis of this scale. Decades of state and federal budget cuts and disinvestment had weakened the foundation of our public health response systems. Here in Alameda County, that has meant that our public health department has seen communicable disease funding cut by 5% for each year for the past decade. The funding we do receive is often time-limited and categorical, only meant to address certain activities or diseases. When the pandemic hit, we experienced the need to significantly ramp up the number of contact tracers, data analysts, epidemiologists, and public guidance staff. We had to create a testing team from scratch. Our local public health department had 7 case investigators that responded to the more than 80 reportable diseases under California state law. By contrast, at the peak of the pandemic, we needed more than 200 just for COVID-19. Statewide data collection and reporting systems were antiquated, paper-based, and labor-intensive. But we've learned a lot from this pandemic, including that when we make system-level investments, we are investing in the health of our communities. But the investments made over the past year are time-limited and specific to COVID-19. To be fully prepared for the future, we need ongoing support for public health infrastructure, from disease surveillance and epidemiological analysis to disease investigation, contact tracing, and community-based programs like home visiting and ensuring food safety and healthy environments. My public health colleagues and I carry the responsibility to protect and promote public health for all Californians. To carry this mission forward with positive impact and long-term benefits within our communities, we must invest in public health infrastructure at the local level. We must pursue the path to readiness to meet the next crisis head-on, to protect our residents, and to maintain our vibrant communities. Another crisis is inevitable. It could be a pandemic, a wildfire, extreme heat, an earthquake, or poor air quality. But what we know is that each will require local health departments to be ready to assess the situation, deploy appropriate supports and interventions, and ensure a swift and equitable response. California can't wait until the next public health crisis. We must invest in public health now.